Garrett Ball with Secure Medicare Solutions. Thank you for watching my video. Today I'm going to talk to you about why you should compare your Medicare Part D plan on an annual or at least biannual basis to make sure you have the best plan for your specific needs. And I'm also going to show you how to compare Medicare Part D plans using Medicare's website, Medicare.gov. First, a word about why you should compare your Medicare Part D plan. First and foremost, the plans change on an annual basis. This means the premiums can change, the deductible can change, the co-pays for your specific medications can change, and also the formulary, which is the list of medications that plan covers, can also change. So your medication may be covered one year and not covered the next year, or you may have a certain copay one year and it may be double that the following year. So it is important to keep up with it and to look at it on an annual or at least biannual basis. And next, I'm going to show you exactly how to do that in very easy, simple to understand terms using Medicare's website, which is Medicare.gov. Okay, so here we are on Medicare's homepage, which is Medicare.gov. We're going to start on the green button here that says Find Health and Drug Plans. Once you click on that, it'll take you to the screen where you enter your zip code. For this comparison, I'm just going to use my zip code, and then you'll click Find Plans. Now, if your zip code is in multiple counties, you'll have to select your county as well. So we'll do that. And then that takes you to a screen that has two questions. Those questions, you can fill out answers to those and fill in a lot more information about your current plans, or, and this is what I recommend, just check the bottom boxes. I don't know, because it does not affect your results at all, how much information you enter there. The next step is enter your drugs. So it'll take you to a screen where you can enter in the names of your drugs. You just type the first few letters and then it should pull it up. I'm just going to use a couple of examples here of common medications. I'll show you that again here, but when the medication comes up, after you enter it, let's do another one. After you select it, then it'll pop up the dosage, the various dosages for that medication, the quantity and the frequency, as well as whether you get it from a retail pharmacy or a mail order pharmacy. So you'll select, let's say you take 20 milligrams of this particular one, click Add Drug and Dosage, and it will come up there. You'll see both medications in your medication list. Just an aside is you may want to write down this information up here. This information can be used to go back into Medicare's website and pull up your drug list on an annual basis. So once you do this one time, Medicare stores your information using this unique ID and the date that you originally did it, and you can use that information to go back in there and not have to retype in all your medications at a future date if you want to run the comparison again. So the next thing is my drug list is complete. Once you do that, it'll take you to the pharmacy screen. And on this screen, you can select the pharmacy that you prefer to use. You can actually even select a couple of them. If you see the drop-down menu here for the radius in miles, so if you don't see your pharmacy listed or you want to look at more, you can add to it here. And so we're just going to select Add Pharmacy there to pull up the pharmacy. Then once you do that, it'll say your selected pharmacy. Then you click Continue to Plan Results. So the next thing you'll see is a screen that shows a few different plan options. What we're looking at today is Part D, so that's prescription drug plans. So you'll check that little box, and then down to Continue to Plan Results, you'll see there's 22 plans, 22 Part D plans available in my zip code. So Continue to Plan Results, and then what that pulls up is a list of all the Part D plans ranked in order of total annual cost, lowest total annual cost. Now you can sort it a different way if you would like to do that. You can go just by premium if you want to just look based on which plan has the lowest premium. You can look at the overall star ratings, which are over here, or you can just what I recommend doing is basing it primarily on the lowest cost. And it ranks them by the remainder of the year. So you can look at that number here, which is, on the left-hand side. So this is your estimated annual drug cost, and then the monthly premium is in the next column. But what I like to do is select, you can compare up to 3 at a time. So what I like to do is compare the top 3 choices. You can't do any more than 3, but you can compare 3 at a time and then come up here to where it says compare plans. Click that, and that will take you to a plan comparison where you can see the plans side by side. You can see the premium up here, the deductible. You can see the annual cost. Keep in mind this is enrollment today. This is not for a whole calendar year. You can see the whole calendar year where it breaks it out month by month here. And then you can see the medications that you've entered. You can see what tier they fall under on different plans. This is an example here of this particular medication. Simvastatin is a tier 2 on this plan and tier 1 on these plans. So those are the variables that can impact the overall cost on the different plans. So what I like to do when I have 3 plans pulled up is to go just below the drug list to click on Print Comparison Report. Now you can print out hard copy if you have a printer and want to do it that way. This screen will come up and you can just select print. That doesn't automatically print it. That just pulls up a printable version. From this screen, you can print it. You can right click if you want to do that and then print, or you can just review the information this way or save it as a file. So what I would look at, what I recommend looking at are a few things. First, the monthly premium, that's here. Next, the deductible, that's here. That's under fixed cost. And the other thing is what I would consider to be the bottom line number. This number is found where it says estimate of what you will pay for drug plan premium and drug cost at, in this case, CVS Pharmacy. If you selected Walgreens, it will show Walgreens there. And the January enrollment would be the full calendar year cost. That adds up the premium times 12, that's the monthly premium times 12 months, plus the deductible, plus the copays for your specific medications, which on this plan obviously are 0. And so that number takes into account all the costs you would have for prescription medications over the course of a full year. And that's really the bottom line number. And you can look at this more detailed information. Definitely do that. This shows what the cost would be in the deductible. Of course, these plans don't have a copay at all, and they're fully covered by this particular plan, so there's no cost during the deductible. Initial coverage level is Medicare's fancy way of saying copay. So that would be your copay. Like on this plan, the copay would be $6.50 for each of those medications. Coverage gap is something you would have to worry about if you fall into the Medicare donut hole. Someone that's on these 2 medications obviously doesn't come close to that, but if you do take a lot of medications or expensive medications, that would be important to know as well. And then you can go down here and see the month by month cost for these particular plans, and that's a total cost, the premium plus the copays. And then down here, if you go down further, you can see the same cost at a mail order pharmacy. So most of the plans, almost all the plans now have a mail order option, and you can see the cost for mail order down here. So that's how to run a Part D comparison on Medicare's website. It's really pretty easy to do, and once you've done it once, it saves your information. You can use that code I showed you earlier to get back in and not have to re-enter the information. And then once you pick a plan, you actually can enroll right here on Medicare's website. We don't sell Part D plans, but I do help do the comparisons. But you can enroll using the non-member number right there. Each plan has one, or you can click the enroll button. And when you do that, it'll take you straight through the process. You enroll directly through Medicare, and Medicare moves you from your current plan to the new plan effective January 1st. If you have any questions about any of this, feel free to give me a call, and my number will be on the next screen. And thanks for watching my video.